Over to you.
Good evening. I'll be presenting a tale of two traumas, which is visual outcomes in closed globe injuries with and without head trauma. The ocular trauma has a wide variety of presentations in an OPD where the patient ranges from a simple contusion to a globe rupture, and the patient has a vision of 6/6 with no perception of light. Our aim of study was to analyze the influence of head trauma in the visual outcomes of the patients who had an ocular trauma, also known as a closed globe injury. It is a type of cross-sectional study of study duration 3 months. Our study had 300 patients, and we broadly classified the patients as group 1, who had both a concomitant head trauma and a closed globe injury, whereas group 2 had 150 patients who had only closed globe injuries. We included age group of 18 to 65 years and patients with severe head trauma with GCS less than 9, and any patients with open globe injuries were excluded in our study. Visual acuity during our first presentation of our trauma and at the end of 2 months was recorded. We analyzed the factors like head injury, lid involvement, and bony orbit involvement, and we also analyzed whether it had any impact on the visual outcomes of the patients. Coming to the results, the age distribution in both the groups, it was predominantly a younger age group of less than 30 years, and it showed a male preponderance. In both the groups, the major cause of closed globe injuries were road traffic accidents. And coming to the ocular manifestations, in group 1, that is who had both a concomitant ocular trauma and head trauma, patients presented with papilledema, whereas in group 2, it was a subconjunctival hemorrhage. We also analyzed whether GCS had an influence on the visual outcomes, in which a very mild head trauma where GCS more than 12, about 56.5% of the patients improved in visual acuity, whereas in moderate head trauma it was relatively less. Visual outcomes in patients with papilledema in group 1, it was about 27.3% of the patients who showed an improvement. In group 2, who had only ocular trauma, 5 patients had either disc edema or papilledema, which could be explained by the bilaterality of the ocular trauma, and it also disappeared by 2 months. We also account that the papilledema may be due to a head injury, which was not actually detected by our radiological investigations. This graph shows the incidence of RAPD in both the groups. Apparently, group 1 had a higher number when compared to group 2. Visual outcomes in patients with RAPD, we analyzed that in group 2, 6 patients did not improve, and whereas 15 patients improved. We also account that in radiological investigations, we noted an intraorbital or canalicular injury to the optic nerve, and certain patients of 3 patients had optic nerve decompression, but they did not show a significant improvement at the end of 2 months. As said earlier, we also noted the influence of a bony orbit involvement on the visual acuity improvement in patients, where in group 1, a blowout fracture was most commonly involved, and in group 2, a medial wall was involved. Visual outcomes in patients with lid involvement, the visual outcomes was very good, whereas 56.4% and 74.6% in both the groups showed improvement. Coming to the discussion, presence of head trauma in patients with papilledema had a poor prognostic factor. The presence of RAPD in patients with head injury also had poor visual outcomes, and the results were statistically significant. In our study, we also found that, as described earlier, bony orbit involvement affected the visual outcomes in both the groups, but the results were statistically insignificant. And visual acuity at the end of 2 months in patients with lid injury improved, and the results were statistically significant. So these are our conclusion and take-home messages from our study. Head trauma, when happens along with ocular trauma, has a very important prognostic significance in visual outcomes. And we also use GCS as a scoring system to assess the general prognosis. So the presence of papilledema in the presence of head injury and ocular trauma is a grave prognostic factor to decide the visual outcomes. And when there is an RAPD in association with head trauma is an ominous sign. Bony orbit involvement, if present, it decreases visual outcomes even though the results were insignificant. And lid injuries in our study did not affect the visual outcomes irrespective of both the groups. So we conclude from our study that papilledema, RAPD, and bony orbit involvement can be taken as the factors which predicts the visual outcomes in patients who had a concomitant ocular injury and head injury. These are my references. Thank you.